Pharmative friends out there, I'm Dr. James Partyka. I'm a clinical pharmacist, research scientist, and the founder of PHARMATIVE. PHARMATIVE is all about helping you, helping your friends and family, your coworkers, staying healthy and well. And PHARMATIVE is the first private social media network dedicated to your healthcare and fitness. So check out pharmative.com for more healthcare news. You'll also be able to catch a replay video of this particular PHARMATIVE Live event. And we're coming to you live from the state of California. And I want to give a big shout out to my Boston friends and family out there and say, go Pats, go Sox. And this is PHARMATIVE Live. I recently received a question from a good friend of ours, Tanya, out there, and she wanted to know, are vaccines safe for preventing flu? So today we're going to talk for about 5 to 10 minutes talking about the benefits of getting a flu vaccine. And if you have questions out there, you can not only text to us live, or you can send your questions in at info@pharmative.com. So today we're going to be talking about getting your flu vaccine. And we're going to start off just briefly talking about the epidemiology. Now, epidemiology is the study of the distribution, the frequency, and the determinants, the causality of human disease. So if we review the epidemiology, and this data was obtained through the Central of Disease Control and Prevention at cdc.gov, and you can get a lot more information at that website. It's a user-friendly website. Our tax dollars are paying for the CDC center, and the statistics that I provide are very useful, again, in the controlling human disease, but also prevention. So unfortunately, I'm going to start with some startling statistics. Last year was a high number of cases of influenza, and it was estimated that 34 million Americans got the flu last year. Now remember that the flu season is between October through May, and it peaks a little bit different every year, but last year was January, February, March of last year. So 34 million people got the flu. 710,000 were hospitalized, unfortunately. And very startling is this number right here, that 56,000 people died to the flu. Now, you and your loved ones can get the flu vaccine today. Go to your local pharmacy or clinic that provide the flu vaccine. It's usually minimal cost. Sometimes it's available free through your insurance or through your employer. So I encourage you, get your F shot today in order to prevent this from happening this year. Okay, now the flu is caused by a virus, the influenza virus. There are different strains of the virus. It's constantly mutating, the strains, and therefore every year a new vaccine is developed based on what we think is likely hit the United States for the upcoming flu season. It's spread by coughing, sneezing, and close contact to others. So by you getting the vaccine today, you will reduce your risk, but you'll also reduce the risk of spreading it to others because it is so contagious. So not only get your flu shot for yourself, get it for your family and your loved ones as well, because if a significant number of people get the vaccine shot, we will decrease the ability of the virus from spreading. Okay? The symptoms, which many of you are probably quite familiar with, include fevers and chills, and it's a sudden onset. Sore throat, muscle aches, fatigue, cough, headache, and a runny, stuffy nose. Those are the symptoms. And again, it comes on quickly. So again, if you suspect you're experiencing flu-like symptoms, you want to stay at home and you want to get your rest and you want to get in touch with your healthcare professionals out there if it gets serious with difficulty in breathing or changes to your heart rate, dizziness, and so forth, because then it may be leading itself to a more severe complication, which we want to avoid and prevent. So, the flu can lead to pneumonia, blood infections, and in children can cause diarrhea and seizures. So again, it's important to do everything we can to arm ourselves against the influenza virus. It's extremely dangerous for infants, some young children, the elderly, pregnant women, and people that are immunocompromised. And by immunocompromised means that they have a weak immune system for some reason that may have been diagnosed, or they be on medications that are suppressing their immune system. Now, we always talk about the benefits versus the risks versus the cost at PHARMATIVE. So the benefits of getting the vaccine is that it reduces not only your risk of getting the flu, but it reduces the severity and the spreading of the flu to others. That's the benefit of getting your flu shot. We just have one more slide. We'd like to keep PHARMATIVE live to approximately 5 to 10 minutes. It's important to remember the following when we're talking about the flu vaccine. There's one new vaccine per season which will protect you against 3 different strains of the influenza virus. The vaccine is not a live vaccine, okay? And it does not cause the flu. So again, I just want to make that clear because I know there's a lot of misinformation about that. But the flu vaccine that you would be getting today does not cause the flu. And it takes about 2 weeks to get full protection. So we're just starting to get into the flu season. So it's important to get it as soon as it's convenient for you to get the vaccine. There are a number of people that should not get the vaccine. And this you can discuss with your doctor and pharmacist to get more specific information about it. But those are people that have had a severe allergic reaction to the vaccine in their history. People with the Guillain-Barré syndrome, that's a syndrome where your own immune system is attacking nerves. So those people shouldn't get the vaccine, and people that are currently ill. So if you're feeling feverish or chills or not quite right, you might want to put it off for a couple of days until you feel healthy to get the vaccine. Serious adverse effects. It's estimated that there's 1 to 2 cases of Guillain-Barré syndrome per million people who receive the vaccine. Now, generally speaking, Guillain-Barré, you will recover from it, but it affects your nerves. So you might have numbness, tingling, ability to walk, paralysis, those kinds of symptoms where you would immediately want to go to an emergency room or a doctor for treatment, supportive care treatment. Serious adverse events also include young children may actually experience seizure caused by fever. So those are the major side effects. There are others. And if you go to this website, Safety of Vaccines at the cdc.gov, you'll get a full list of all of the side effects associated. Again, it's a simple shot, doesn't hurt at all. It's administered intramuscularly. You hardly feel the needle. My partner and I got our flu shots yesterday. We're doing well, and I suggest that you do the same. So that's all we have for today for PHARMATIVE Live. Don't forget, get your flu shot at your local pharmacy or clinic, and I'll see you next week, and stay healthy until then.